Painful and restricted dorsiflexion of the ankle joint may be associated with tightness of the calf musculature. This muscle taping technique is applied to the gastrocnemius to increase dorsiflexion of the ankle joint. First, note the restriction of dorsiflexion. The base is positioned 5 centimeters along the sole of the foot and reaches over the calcaneus to the distal attachment of the Achilles tendon, at which point the tape splits into a Y. Each tail then extends to the lateral and medial heads of the gastrocnemius. While the patient is lying prone on the couch with foot hanging over the edge and ankle in a relaxed neutral position, mark the base point. Gently flex the knee. Place and hold the ankle in plantar flexion. Palpate and mark the lateral and medial attachments of the gastrocnemius. Return the patient's ankle to a relaxed neutral position. Measure the tape from the base point snugly over the calcaneus and along the Achilles tendon before further measuring on upwards to the end point. This will ensure an accurate length of tape. Cut and prepare a Y-strip. To avoid unravelling of the tape caused by constant friction inside footwear, the use of adhesive skin spray may help the tape to remain in situ. Using approximately 10 centimeters of tape, lay down the base without stretch as an anchor. Place the patient's ankle into maximal achievable dorsiflexion to achieve the greatest degree of tissue lift. In this position, smoothly lay down the first tail of the Y-strip with absolutely no tension. This tail is laid proximally along the outermost edge of the muscle belly to the lateral attachment of the gastrocnemius. Maintain maximal achievable dorsiflexion of the ankle and smoothly lay down the second tail with absolutely no tension. This tail is laid proximally along the outermost edge of the muscle belly to the medial attachment of the gastrocnemius. Return the patient's ankle to neutral position. Look for convolutions. The patient should experience immediate increased dorsiflexion of the ankle joint and localized pain relief. If the patient does not experience relief of symptoms, check the tape has been correctly applied or reconsider the chosen technique. This muscle taping technique is applied to the soleus to increase dorsiflexion of the ankle joint and to improve flexion of the knee joint. Using an I-strip, the base is positioned from 5 centimeters along the sole of the foot, reaching over the calcaneus and extending upwards to the proximal attachment of the soleus. The patient should experience immediate increased dorsiflexion of the ankle joint and improved flexion of the knee joint.